CoACT presents A Day in the Life of a Patient. Well, that's me, Amy, and this is what a day in my life as a patient looks like under the new care model, which demonstrates a commitment to starting from my values and preferences and building from what we already know. I was admitted to the unit last night, and I arrived to a clean bed and a prepared team in the right unit the first time. I was oriented to the unit so I feel more comfortable, and my family and I are aware of important information. My nurse comes into my room. She tells me her name, Jackie, her role as an RN, and why she's here to see me. This helps me know who is taking care of me today. Jackie asks me if it's okay if she does shift report at my bedside. My night nurse updates her on my admission last night, my diagnoses, and any plans recommended for my care today. They ask me what my goals for the day are, and I am involved in my own care planning instead of somebody else making all my decisions for me. Jackie asks me if I need any help of going to the washroom, if I am in any pain, if I'm comfortable, and if any of my possessions are out of reach or missing. She tells me I will be checked on every 2 hours during comfort rounds. This means I don't have to use a call bell as much, and my needs and concerns are met proactively. Jackie writes my plan for the day on my patient bedside whiteboard. As she writes, she lets me know who's on my care team and what's happening today, like tests or procedures, and my current anticipated date of discharge. If I forget or my family wants to know, the information is right where I need it all the time. Next, it's breakfast. After breakfast, I receive my meds from a member of my care team. Jackie comes back, this time with a student nurse named Casey. Casey leads the head-to-toe assessment, with Jackie supporting him as needed. They ask me if there's anything I'd like to discuss with the care team, which includes my doctor, about my plan for the day. This gives me an opportunity to express any concerns or questions I might have. Now that 2 hours have passed, it's time for another comfort round. I ask if I could have a glass of water rather than using a call bell and waiting to get one. My doctor does his rounds and checks in on how I'm doing, and so do other team members depending on my care needs. As for my schedule and plan for the day, I will attend any treatments or procedures that are part of my care plan. My family or support group is welcome to attend as well. Next, my care team comes to talk to me to discuss my treatments and care plan and what needs to happen in order for me to be transitioned to the next level of care or back to my home. They discuss any barriers and tell me what my current anticipated date of discharge is. My family comes to visit me before I eat dinner. They are able to see all the relevant information to my care plan on my patient bedside whiteboard, as well as interact with any member of my care team to ask questions. Eventually, it's shift change at the hospital. I meet my new care team as the outgoing team updates the incoming team on my day and care plan. They ask me how my care was today and if I have any other questions. Because the team is able to communicate effectively during the changeover, I do not have to tell my story multiple times. This plan repeats each day I'm in this level of care until I'm transitioned to a different level of care or back to my home and community. Under this new model of collaborative care, I feel like there is a team of providers looking after me, and I see them working together to provide my care, which makes me feel confident and happy. I feel comfortable, in control of my care, and confident that I'm on the road to getting well again.